The New York Times is reporting the Centers for Disease Control has been withholding COVID-19 data from the public eye. According to the report, the CDC failed to tell people about data relevant to the effectiveness of boosters on those between the ages of 18 and 49. By the way, those are the people who are least likely to benefit from the shot, right? Other than those even younger. CDC is also being criticized for failing to publish information they collected about child hospitalization rates and comorbidities. So what could they possibly be hiding? I'll give you my reaction to all this in tonight's Buck Brief. They say, listen to the science. And if you disagree with them, they tell you to shut up, and they'll send police after you, and they'll get you fired from your job, and they'll use government force to take you down. But are they even really listening to science themselves? Well, of course not. They've been full of crap. They've been full of crap the whole time. That's not a surprise to any of you watching this, listening to me right now. But this is particularly egregious. New York Times, not some right-wing anti-vax person or whatever. The New York Times has reported the CDC has been routinely collecting information since the COVID vaccines were first rolled out last year, according to federal officials, and withheld it from the public. The agency has been reluctant to make certain figures public, according to an official with the CDC, because they might be misinterpreting the vaccines as ineffective as a result of the data. That's right, folks. This is them saying, we can't tell you what's going on because you might not believe our vaccines are so awesome. Also, the New York Times article, the performance of vaccines and boosters, particularly in younger adults, is among the most glaring omissions in data the CDC has made public. And then it says the CDC has also, it has also been difficult to find CDC data on the proportion of children hospitalized for COVID who have other medical conditions. This is according to the American Academy of Pediatrics Committee on Infectious Disease. They said the Academy staff asked their partners at CDC for that information on a call in December, and they couldn't get it. This is according to a spokeswoman for the AAP, and they were told that it wasn't available at the time. Okay, folks, let's just look at this right now for a second here. When you're talking about vaccine booster efficacy, you're talking about children being hospitalized for COVID and what comorbidities they had, or what essentially other conditions they had at the time that might have led to the hospitalization. Why don't we just know what actually happened? Why aren't we being told what the real data is? Let's understand what's happening here. The CDC is withholding information from the public. This is a publicly funded, this is a federal government agency that thinks that the people of America, whom are supposed to be able to look at these numbers and come to conclusions about what's actually going on here, and then vote to have actual accountability for the elected representatives who are either going along with this or not. CDC is saying we're actually hacking the system in essence. We're not going to give people the data they need to figure out whether or not what we're doing makes any sense. Now, this has led a lot of people, understandably, and I'm certainly one of them and have been for a long time, to think the CDC is a politicized bureaucratic monstrosity. Here's FAUCI saying that the CDC is not irrelevant. Of course, he stands behind the health bureaucrats. Watch.
Has the CDC lost some of its relevancy?
No, I don't think so. I don't think so at all. The CDC is very relevant, John. They look at the scientific data, they analyze the data, and they make recommendations. It has always been the case that at the local level, the local health authorities working with their administrative leaders, be they governors or mayors or leaders at the local level, will make their decision. They could utilize or not. I think it's the wrong thing to say that the CDC is irrelevant.
The wrong thing to say. Of course he says that. Fauci is an evil bureaucrat who has made everything in this country worse during COVID and pretended like he's the savior while he did it. Now, he's not the only one. There's others out there who are still pushing the absolutism approach to COVID. Here's CNN's Dr. Rayner saying it's safe to assume that we're not done. There's going to be more shots in your future. Watch.
So the CDC and FDA are going to have to balance the benefit to an additional fourth dose, which we do think is safe, with the necessity to do that, given the fact that cases are dropping so quickly in the United States. I think it's very reasonable to assume that at some point, everyone is going to be redosed with another dose of this vaccine. And whether that comes late in the spring or early summer or the beginning of the fall, I think it's safe to assume that we're not done vaccinating for this virus.
We're not done vaccinating. This is vaccines forever, folks. Some of us warned about this in the very beginning. Once you make mandatory vaccines, especially for a rapidly mutating virus that has animal reservoirs as well as human reservoirs for those mutations, and that is now endemic, meaning it's not going anywhere. Some of us were saying this is going to lead to the endless vaccination and health policy state that we currently see ourselves in. And of course, instead of looking at the massive failures of this campaign up to this point to stop the spread, you have people who are blaming misinformation. Here's Bill Gates. Yeah, the guy's rich because of computers from in the 90s, basically, right? Microsoft. Here he is saying that misinformation enhanced vaccinate. What does this guy know about health policy? Well, he's saying misinformation is the problem. Watch.
Well, I think the mainstream media did a reasonably good job. The scale of the misinformation, once you move past the mainstream media, is so wild you almost have to laugh about it. There's no doubt that the misinformation enhanced vaccine hesitancy, and that maps to hundreds of thousands of deaths. As we look back over the pandemic, having the politicians speak out, that doesn't work very well because then you have a lack of trust.
A lack of trust. Gee, I wonder if that could be made worse by, I don't know, the biggest federal health agency withholding data from people so they can't actually know what's true and what's not about the boosters of efficacy in those who are already at low risk from COVID. My friends, other countries are wising up to this, and the politics have shifted. So now the policies are shifting as well along with it. There are places that are just deciding now and have in recent weeks to stop pretending like if we just double mask and act like lunatics, we're going to beat this virus. It didn't work. It won't work. It was never going to work. Here is the British Prime Minister, for example, Boris Johnson, saying that all COVID-19 restrictions are done in Great Britain. Watch.
But because of the efforts we've made as a country over the past 2 years, we can now deal with it in a very different way, moving from government restrictions to personal responsibility. So we protect ourselves without losing our liberties, and maintaining our contingent capabilities so we can respond rapidly to any new variant.
That part of it's a little bit of a problem, though. Respond rapidly to a new variant, how and with what? Now, some of the places like the UK that are removing these restrictions, they need to actually go further than that. Understand the restrictions didn't work, friends. This stuff failed. They failed. They made you do things. They made you get shots. They made you take masks or wear masks. Made you do things that didn't end up working the way they told you that they promised you they would. And so there has to be a reckoning now. There has to be a realization of just what has occurred here and what the reality is around all of it. And we'll continue to follow this here on Hold the Line. The Canadian government has voted to extend emergency powers after blockades and protests have actually been cleared out by the cops. So what's the end game here? Where's the outrage from the brutalization of peaceful protesters? Well, of course, because the left likes this stuff.